Welcome to another episode of The Rogue Dermatologist. In this video, I'll talk about balanitis. What is balanitis? The big mystery. Balanitis is irritation of the head of the penis, otherwise known as the glans penis. That is the tip of the penis only. So it's not the shaft, it is not the scrotum, it is actually the head of the penis that's involved. Balanitis can look like redness, itch, burning, pain, sometimes even painful cuts or pimples on the head of the penis. Those are pretty common symptoms and signs of balanitis, but it is not very well known that balanitis can have many different causes. In this video, we'll discuss the causes, we'll discuss what not to do, we'll discuss what can be done for balanitis, and how to get your problems resolved. So what is balanitis? Well, balanitis, as I said, is irritation of the head of the penis. Irritation meaning that the skin is worked up or angry or grumpy, and that is the end result of whatever process led to those symptoms. But there are many causes for balanitis. Most common causes are actually idiopathic, meaning we don't really know what causes the irritation, but the irritation is present, and then we have to deal with the results and pull away from anything that's harmful, treat whatever is happening, and obviously stay on the narrow path of great skincare. Other causes of balanitis can be chemical irritation of the area by virtue of using detergents or cleansers or other products that are meant to somehow care for the skin of the area. And then there is the physical friction or physical irritation by scrubbing, cleaning, so to speak, and other practices such as sexual activity that can really irritate the area by inducing friction over the skin. Other causes of balanitis are infections of the area, such as fungi or yeast overgrowth, bacterial overgrowth, and in some cases viral infections of the area, specifically herpes simplex virus infections. Those can all cause balanitis, and they all need to be treated specifically for the cause that is inciting the symptoms and creating your skin condition. So what to do about balanitis? Well, very importantly, the first thing to do is do no harm. So what to avoid? Very importantly, do not go for the knee-jerk reflexive reactions that most people go to when their skin is irritated, much more so the head of the penis. Avoid extensive cleansing and irritating practices. So do not use hot water over the area. Do not use chemical abrasives over the area. That means soaps, cleansers, body washes, and other forms of detergents. Don't use physical abrasives over the area. Don't try and scrub the area clean. That will make your situation worse no matter what the cause is. That means you want to avoid loofahs, scrubs, exfoliants, brushes, washcloths, and any other thing that's physically abrasive over the area. That will not help your situation. In fact, it is guaranteed to make your situation worse and further disrupt the skin integrity. Other things to avoid are disinfection of the area. So alcohol wipes, disinfecting wipes, and any other disinfectants such as hydrogen peroxide and other disinfectants over the area. Those will invariably lead to irritation of the skin. Unless you agreed about this with your board-certified dermatologist, do not engage in these practices automatically. They will make your condition worse. Also, avoid treating things automatically. Specifically, avoid applying antifungals or antibacterials just because you think it's a good idea. The cause of your balanitis may be something completely different than what you're trying to treat. And treating the wrong thing with the wrong medication may actually lead to more irritation of the area and worsening of your balanitis. So avoid these things, avoid those automatic knee-jerk reactions, and don't treat your condition automatically unless you know exactly what it is that you're doing. So what can be done? Well, rinse the area with lukewarm water. Do not go into the hot temperature range. Don't go above 104 degrees Fahrenheit or 40 degrees centigrade. Use lukewarm water. Do not use soap, as I said. Do not use anything to clean the area. Cleaning practices are really not cleaning at all. They're actually disrupting the integrity of the skin. The balanitis is already a sign that the skin is already compromised. It's already suffering. Don't make your condition worse. Go see a board-certified dermatologist. Help the dermatologist make the right diagnosis, come up with the right treatment plan, come up with a time frame in which things should get better as expected, and follow up with your dermatologist to make sure things are actually turning around in the right direction. If they're not turning around in the right direction, more tests may need to be done, specifically sometimes a culture, sometimes even a skin biopsy to determine what is the cause of the irritation, and then follow up with a corrected treatment plan in case it didn't work out the first time. It's very important to know that balanitis, much like other irritations of the privates, will turn around pretty quickly within about a few days to a few short weeks if the right diagnosis has been made and the right treatment has been prescribed. Balanitis usually turns around within a few days to a few short weeks with the right diagnosis and the right approach. There are outlying cases where even with the right diagnosis and the right approach, things continue to irritate the area, and those could be many different things. The area is obviously exposed to a lot of friction and a lot of irritating elements day to day, so it may not be that straightforward. That being said, getting away from all the obviously irritating practices over the area is a good start. Starting treatment and following up with the right time frame and the right expectations in mind are a very good start. If you derive benefit from this video, like, subscribe, and share with the ones you love. Make a difference in someone's life. Let them know about the work of this channel. More great content coming your way right from this channel. Thanks for watching, and God bless.